This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you. This is going to be a general overview. Chapter 26, Principles of Medication Administration. Now, before we even get started on this chapter will be gone over in much more detail in your pharmacology section. So whenever we get to PC2, Paramedic Care 2, in this section, medication administration, especially drug dosing and math for medications, we will go into detail, work on formulas, and work on the math side of it. In this section, this is just a general overview and an orientation. Key concepts. After the completion of this chapter, you will be able to understand the metric system of measurement, and all medication pretty much goes off of the metric system at this point. Basic drug calculations, including weight-dependent drugs and intravenous infusion rates, or at least what they're used for. The 6 rights of medication administration, routes for medication administration, topical anatomy and proper techniques for injection, and this will be covered in your skills section for this block of instruction. So intramuscular, intradermal, subcutaneous, IV bolus, and so on. Medication administration. It's the paramedic's responsibility to choose the right drug and the right dose for the patient, administer it by the right route and the right time. Forms of medication. There are several types and forms of medication: liquid, solids, and injected meds. Please go over these definitions. Know the difference between a spirit, a tincture, a syrup, suspension, magmas, emulsions, lotions, and ointments. You should be able to find these very easily in your book. Spirits, volatile oils that evaporate at room temperature. Tinctures, medicinal substances that are dissolved in alcohol. Syrups, things that are mixed with sugar and water. Suspensions, they don't ever completely dissolve, so they're always separated. You always have to shake a suspension well. Magmas, powder drugs with particles so large that they're visible when they're mixed or suspended in water. Emulsions, finely pulverized particles placed in oils. Lotions, medications meant for the skin placed in water. Ointments, medications meant for the skin placed in lanolin or petroleum jelly. Solid medications, I think all of us have had some dealings with some tablet capsules and enteric coating. Enteric coating is put on there so that it protects the stomach. Lozenges are things that we generally use, like cough lozenges. First pass metabolism, be sure you're aware of that. It'll make it easier for when we go through pharmacology. Chemical degradation of the drug by the liver that markedly reduces the drug's bioavailability. So if you take something orally, you lose quite a bit of the drug because of the first pass effect. And then suppositories. Medicine within a wax carrier that melts at body temperature. Injected medications are ampules and vials. Most commonly these days we use things that are plastics with rubber stoppers instead of the glass vials. We'll still find some glass vials out there. Be careful not to cut yourself. There's always a sterility whenever we're talking about a vial, and a vial is the one that has a serrated edge that you break. Ampules would be single patient use, or vials intended for multiple patients. Vials are resealable ampules. In a sense, vials are kind of resealable ampules. Injected medications. They either come in ampules or vials. Generally reserved, the ampules are generally reserved for single patient use. or vials are intended for multiple patient use. Those are the ones that will be the multi-dose vial and have a stopper in the top of it. In a sense, vials are resealable ampules, typically in a glass container. Most of them are, like I said, are now in a plastic bottle. Has a rubber stopper that can be breached with a needle or syringe. Volume of the medicine withdrawn in the needleless system. Whenever you have a certain amount of fluid that's in there, and there's a certain amount of parts per million of that medication in that fluid. So this is where math for medications will come into play, that you'll need to dose appropriately the patient depending on the concentration strength of that ampule or vial. Always a concern with a vial is sterility. Drug measurements and dosing. The importance of precise measurement is essential. It can make the difference between a therapeutic dose and a toxic dose. The apothecary system we don't use so much anymore, but it's still kind of around. Measurements include grains, which equal the weight 1 grain of wheat, and a minimum the weight of water equal to a grain. We don't use that so much anymore. Common household system, we don't use that because the graduates are too large. Contains units such as foot, ounce, and teaspoon. We'll still get conversions from the metric system to teaspoons, though, especially in children's medications. The metric system is what the scientific community and the pharmaceutical companies kind of go to. This is table 26.1 in your book, if you'll take a look at that. Special units. Some dose of medications have to be determined by biological assay or bioassay. A method of determining the relevant strength of a substance by testing it on an organism. To standardize these bioassay measurements, scientists have created the international unit. Measurement devices. Medicine glass is a quintessential example of the medicine measurement device, which is essentially a dropper. Glass vial with medicine in it and a dropper. So as far as dosing and measurements go, all of our dosing nowadays is done off the metric system. We still use some of this, which would be like a teaspoon or tablespoon. Apothecary system, the grain and the minimums, we don't use so much anymore. We will cover those a little bit in Math for Meds and Pharmacology. This is 26.1, metric equivalents of household common measurements. Example why the household doesn't exactly work to the metric so much. 1 drop is equal to 0.06 mils. 15 drops is equal to 1 mil. 5 mils is equal to a teaspoon. And these are the things that I told you that we probably would look at, like these right here. 15 mils is a tablespoon. 30 mils, 2 tablespoons, or 1 fluid ounce. A cup, 240 mils. A pint, 500 mils. A quart, about 1,000 mils. 32 ounces. So we'll take a look at these, like I said, whenever we get to pharmacology. Mathematical conversions, conversion from the metric system, conversion of weight. Very simply, we do a lot of conversion. Most people know their weight in pounds. So the easiest way to determine their weight in kilograms, if they were 160 pounds, would be to divide that by 2.2. Very simply, that would give us their weight in kilograms. And again, we'll do plenty of that and talk about more about that in Math for Medications. This is table 26.3, conversions of measurement in the common household and international metric system. And an inch in millimeters is 26.4, an ounce in grams dry weight measurement 28.3, a pound 0.453 is equal to a kilogram, a gallon 3.79 is equal to a liter, U.S. conversions, millimeter 39.6 units is an inch, or 1/25.4. Very simply, we need to stick with one language here. It is difficult whenever we're talking about conversions. So whenever we talk about medicine, we'll always deliver it in milliliters. The teaspoon, tablespoon will come into play because in your history of a question, you might come across the patient has been administered 1 teaspoon of medicine X. How many milligrams did he get? Those will be some of the questions that you'll see in pharmacology, but we'll get plenty of time to look at the conversion. So very simply, there is a conversion for the U.S. version and the metric system. Concentration. Concentration is important because it is the amount. An example of this, let's say lidocaine, 100 milligrams and 5 mils. Now, what the concentration is, this right here is your concentration strength of your medication. So in lidocaine, 100 milligrams will be placed in or diluted in 5 milliliters of fluid. So this is what we mean by concentration strength. And most of the time on these medications, whenever you're doing problems, you will need to find the concentration strength. Example of this, physician orders 20 milligrams of furosemide IV bolus. The drug box is 40 milligrams of furosemide, a concentration strength of 10 milligrams per milliliter. We do a cross multiply on this very simply. 20, 10, 2 mils. We'll do more of this as well in Math for Meds. Elements of a drug order. Standard drug order, which is the amount of the drug, the name of the drug, and the route is to be administered. And then there's a weight-dependent drug order. Means that X amount of the drug is to be given to the patient, and that would be determined by their weight. So the first thing that we would need to do on a weight-dependent order is to calculate the patient's weight first. And there's always going to be a factor on this. Let me kind of explain that. So let's say that I wanted to administer 5 milligrams per kilogram. And they weighed 160 pounds. So first of all, I need to get the pounds converted to kilograms, divided by 2.2. And then I would take that answer, however many kilograms there are, and multiply it by 5. That's how much drug they would get in milligrams. That amount, I don't know how many mils that is, over whatever my drug concentration strength per milliliter is on hand, and then cross multiply. And we'll do plenty of these. So that is our weight dependent order. Pediatric dosing. Pediatric dosing is done via Braslow's tape, and that's a colorimetric tape or weight-based tape. So we roll it out on their head, and it gets a guesstimate of what they should weigh or what their ideal body weight should be. Always confer that with mom or their caregiver. How much did the child weigh last time? So that they can give you essentially the gospel on that. The closest weight possible, because kids are getting larger, we're getting larger. The United States is getting more obese as time goes on. So very simply, if the child weighs more than the Braslow's tape states, go by the definitive weight. Intravenous infusions. Important concepts. First one here, it gives a continuous amount of medication and a continuous infusion over time. So if we wanted to give them X amount of the drug per minute, a continuous infusion would be the easiest way to facilitate that. Constant venous access. It gives us access to their veins in case something goes bad or they get an untoward effect of the medication very, very rapidly. Infusion a specific volume. An example of this is, let's say I had a bag of drug. And in that bag of drug, I had 50 milligrams of drug X. And I wanted to deliver that entire bag, so it was in 100 mils, over 10 minutes. Well, the easiest way to do that is I need to deliver to my patient 10 milliliters per minute. And then that entire bag would essentially go in over that time. We'll do some of these too. These are whole equations for this. Intravenous drug infusion. An intravenous drug infusion is a continuous amount. This kind of talks back to this, a way of delivering the drug continuously to the patient. Weight-dependent intravenous drug infusion always has a weight dependency. So an example of one of the formulas for the weight dependent is dose times weight in kilograms times our drop factor divided by the concentration strength of our drug. And that will be given to us the answer in drops per minute. And again, this is something that we're going to do in pharmacology. Temperature measurement. Patient's body temperature, key indicator of the patient's health and illness. Fahrenheit and Celsius. There's conversion factors. Again, we'll do some of these in the actual pharmacology chapter. Chapter 4 through 6 in pharmacology is where we'll be talking about these. Administration of medications, the 5 rights. The right patient, the right medication, the right dose, the right route, and the right time. DARE mnemonic is data, action, response, and efficacy. Now what that means is do I have any data? What was the action that was actually taken on my patient, or what action, once I gave the medication, what action actually occurred? Their response to the medication, was it a good response or a bad response? And efficiency, how effectively and how efficient did I actually facilitate that? Medication routes, prepare the medication for administration using the AIR mnemonic, allergies, intended effects, and reasonable risks. Local routes, otic medications, which would be through the ear. Local nasal medications, which would be in each nair. Local oral medications, would generally be by pill. Topical medication, which would be something on the surface of the skin, or other local routes. Other local routes, an example of this would be an enema. Routes for systemic medications, enteral drug administration, sublingual route, which is under the tongue, buccal route, and between the cheek and gum, oral route, which would be via pill, gastric tubes, crush up pills and introduce them via an NG or a gastric tube, percutaneous gastric tubes, and then the rectal route, which would be suppositories. Perennial drug administration, and this is intranasal route, and this would be into the vascular system through the mucous membranes. Respiratory route, which would be through the capillary alveolar membranes of the lungs. Pulmonary treatments are some examples of these, and then the topical route. Nitroglycerin ointment would be an example of a topical route. Injections. Tools for injections would be a hypodermic syringe, hypodermic needle. Hard is the needle. Needle safety is always important. You do not want to stick yourself, especially after you've stuck your patient. And then medication containers. Hypodermic syringe has a syringe, a needle, a hub, a lure lock, which is where the needle actually attaches to the syringe, and then a barrel, a shaft of the actual syringe. The purpose of the syringe is either to inject a liquid medication out of the barrel or to withdraw blood into the barrel. As far as routes of injection, perennial injection, intradermal, capillary blood draw, subcutaneous injections, and then intramuscular injections. In conclusion on this, paramedics must master a large number of medication administration routes and techniques as a part of their skill set. Each medication route has its advantages, drawbacks, indications, and contraindications. It is a paramedic's responsibility to ensure that the patient medication needs and preferred medication route are compatible. Now, again, we are going to cover this in detail in your pharmacology section. If you have any questions concerning this chapter, feel free to contact me. My name is Roy Smith, smith@emsa.net, 45219-7613. Thank you.